to start?
Sure.
Okay. So when we are using the puppet technique in play therapy, the therapist actually gives the client, or if it's a family, if it's an individual or family, they give them a prompt, a directive to, when it's client-centered, the therapist asks the client to make up a story. And it has to be completely made up, and they act it out. The therapist leaves the room so that the family can feel a little bit more free. They're not under pressure to perform or anything like that. The therapist is videotaping, but then the therapist comes back in and they actually watch it, and the therapist starts kind of asking questions, specifically like, what was that like, for you to see this dinosaur really angry, or you can ask them specific questions to collect more information about the process. So in Mark's case, he's acting out in school, so the therapist needs a little bit more information from him to understand why this puppet is acting out in this certain way, and so it allows the therapist to actually interpret the story.
Yeah, and the prompt gives them the freedom to talk about a story that's different from the story that actually happened, so that they can kind of separate themselves from the actual story, but still connect it. The therapist helps connect it with what's going on. So.
And then in therapist directed,
Then therapist directed is just going to be more. The prompt is going to the storyline is going to be more directed by the therapist. So. In this situation with the therapist just directed the story towards the accident, but used the puppets to help the client access emotions. It could also be in a situation if you wanted the child to demonstrate something that happened to them, they could actually just play it out, or they could show something like if they had some sort of medical procedure that was coming or had happened to them. It just gives them, you can get information, you can ask for it with the separation from their physical body. So.
Yeah, the therapist asking the questions helps understand the process of what's going on with the child and with the family.
The presenting problem, yeah. One of the other techniques that you can use in this is using the puppets actually. Some other variances are like setting goals. So having the puppets actually talk about maybe what they would like to see differently in the presenting problem. And the therapist can kind of guide them in that process, like what would it look like, if maybe Mark wasn't angry anymore, and which we saw demonstrated when she was basically asking.
not so well, but it kind of a little bit demonstrated.
Yeah. But asking, like, what would you need from mom? So now mom has this goal of she needs to give attention more. She needs to figure out a balance and give more attention to her son, who's feeling basically neglected.
And that's a description of the technique.
Yep.
Got a little aggressive, frustrated, was having a hard time listening to the teachers. And then when I talked to him about it later, he just didn't really talk about it. And
Because there was kids who kept talking to me and distracting me. I couldn't help it. They were talking. What am I supposed to do?
I know, but you don't shove them.
Maybe not, but they were being mean.
Well, how is your brother doing? How's your brother doing?
He seems to be doing okay. He doesn't really talk a whole lot either about what's going on, so I don't know how he's doing. He seems to be okay.
I mean, he's recovering well from the car accident, but some of the injuries, the doctor said that it's going to take a lot longer, and I think he's just really traumatized from the accident. And I know that Mark has been very concerned about him. So.
Yeah, I just want to be able to play, like do the things that we used to do.
Yeah.
It's kind of thrown off our whole world, as our normal routine is not the same.
Okay. Well, is there anything, Mark, that you want to talk about today?
Not really. I don't know what to say. I don't have anything I want to say yet. I'm just here because she makes me happy.
Well, because we're trying to help you.
I know.
Okay. Well, I have an idea today. We have some fun little friends that are here, these puppets. And I'm gonna just leave for a few minutes. I just want y'all to come up with a story. Just a story about anything you wanna talk about. And, I'll come back and y'all can do the puppet show for me, okay?
So just make up a story?
Just
or-
make up a story. So, and Mark, you can be the leader of making up the story, okay?
Okay.
So you get to choose what you want the story to be about, and you get to tell your mom, like what part you want her, and then y'all just kind of work out a puppet show for me. Sound good?
Okay.
Okay.
Sitting down here.
Okay.
And they're just walking.
Oh, this is such a nice day.
I'm gonna eat you.
No!
You better run. I'm gonna eat you. I'm gonna eat
No,
you.
you're not!
Oh, no.
Get away!
No, no,
Stupid
no,
dinosaur! Oh, thank you so much for protecting me. Oh, you're a good friend.
Great, thank you for
That
the
was fun.
video.
Was
That was kind of fun.
You enjoyed that?
What a great puppet show.
Gosh, I have not played with puppets in a long time. That's
Okay,
slightly
well,
embarrassing.
let's watch it.
okay.
Okay, we watched it. What were your feelings as you were watching the puppet show?
I think that I was thinking about how afraid he must have been with a dinosaur trying to chase him, because if a dinosaur was chasing me, I'd be really afraid.
I would be really afraid too. Would you be really afraid?
Yeah, I would.
I mean, I know they don't live anymore, but if one did live and it tried to eat you or chase after you, you'd run away, you'd be scared.
Yeah, yeah, it's hard to feel that scared, isn't it?
Yeah,
Yeah.
yeah.
So, wow, that was quite a video. That dinosaur was really big and strong.
Yeah, he was strong. He wanted to try to eat the kid.
Yeah.
Yeah.
What? Tell me, what did you feel as you were watching that dinosaur go after them?
As a dinosaur, I was feeling really angry and mad because I was hungry and dinosaurs are just scary and I wanted to get the kid or get him.
Get him, yeah. You wanted to get the kid. How do you think the kids were feeling?
I think that he was really afraid.
Mm.
He was really scared because he didn't want to get eaten by the dinosaur.
Do you think just one of the kids was afraid?
It seemed like the kid was afraid and then his friend jumped in to try to help him.
Wow.
Yeah.
Yeah. So this one you thought was really afraid?
Yeah, because the dinosaur was trying to chase him. Wouldn't you be afraid if the dinosaur was chasing you?
I'd be so afraid.
Mhm.
I would be so afraid.
Yeah.
So, so then this monkey wanted to come in and save the friend.
Yeah.
How does that make you feel, that monkey getting in there and fighting that dinosaur?
Well, it made the dinosaur afraid of the monkey because the monkey like stood up for him and, you know, chased the dinosaur away. So then the dinosaur was afraid and the dinosaur ran away.
Yeah, that dinosaur was big, wasn't it? But this monkey was brave and went after that dinosaur.
Yeah.
Yeah. Have you ever felt afraid like this monkey? Or well, actually like the boy?
Yeah.
Have you ever felt afraid like that?
Mm-hmm.
Is there any time you want to talk about that maybe this little puppet would understand?
I mean, I think I've been afraid like the puppet with lots of different things at school when kids are mean or they, you know, say hurtful things or people don't want to play with you or that's kind of scary. Too, because you feel all by yourself.
Yeah,
And then I get angry.
sure. You get angry.
Yeah.
And then do you ever have any monkeys come and save the day?
There's a couple kids at school who will be nice to me and be a friend. And I think Mom does that too.
Yeah.
This is, I was not expecting this. I mean, you know, even the fact that Mark said that this puppet was angry, I don't think I realized like how much maybe Mark is aware of that, you know. I see him react a lot at home, I see him react a lot at school, but for him to identify that because of maybe a need or something, and then I guess I'd never heard him talk about school like that.
Well, a lot of times you're busy because, you know, Johnny's hurt and you're taking care of him, so don't really get to talk as much.
Makes me feel like, I guess I just didn't realize how much Mark has been maybe neglected in this whole situation.
So Mark, looking at that dinosaur that is feeling so angry, right? What do you think that dinosaur needs right now? Or do you have any ideas how to make that dinosaur less angry?
I don't know, maybe he's alone too, he just needs a friend or, you know.
What do you think that dinosaur needs to hear? What if these two puppets decided that they were gonna be friends with the dinosaur? What does that dinosaur need to hear to help his anger?
I don't know, maybe if they weren't so afraid of him, like if he was chasing them, maybe if they just stopped and talked to him, kind of like the monkey did, but chased him off, then maybe he wouldn't be so angry. If someone just took the time to like try to be the dinosaur's friend or talk to the dinosaur.
Okay. Mom, do you wanna do that puppet show? Let's see if we can figure out how to make the dinosaur get something the dinosaur needs that Mark just talked about.
So I'm gonna just be like the dinosaur's hiding again?
Yeah, let's just see what happens.
Okay. It's a nice day.
Brr.
Ah! Oh,
What are you doing?
hello, dinosaur. We're just going for a walk.
I'm gonna eat you,
Would you like to join us for a walk?
but I think I wanna eat you.
Sure, but you're here all alone and we're not. Sure you don't want to join us?
I guess I could eat something else.
Yeah,
I guess I could go with you.
we could find food for you.
Okay, that'd be great. Let's go.
Yay, what a happy ending! Okay, so as you look at this little dinosaur, okay, Mark, and you've been feeling some strong emotions too and some anger at school.
Mhm.
Is there anything you want from your mom right now? Or Mom, is there anything you want to give Mark right now?
Maybe more just attention. You know, we haven't had like mommy son time in a while. We used to we'd sit on the couch, cuddle, or we'd go get ice cream. We haven't done that actually in a really long time. I don't know if that's something you would like.
Mhm.
Yeah?
I love ice cream.
You do? So we
Okay,
could do that, yeah.
that sounds great.
Yeah.
And Dinosaur, do you know anything that Mark needs right now? Maybe?
Besides ice cream?
Yeah, besides ice cream when we leave?
I don't know, I think just someone to pay attention.
Mhm.
Like, I think going to get ice cream would make me feel a lot better. I
Yay!
don't have to eat them, I can eat ice cream.
All right, well, let's go.
Okay, I think I know what's happening after this.
Thank you.
Okay, you're welcome. This is a more therapist-directed approach. Okay. So, Mark, how have you been doing this week?
I've just been kind of sad and kind of angry.
Kind of sad and kind of angry. Yeah.
A lot. He's been acting out a lot at school. He's not been doing his chores at home. You've been just giving me a lot of resistance. I mean, it feels like it's intensified more so. I mean, I'm giving a lot of my attention and my direction to our other son, Mark's brother, and because of the accident, he is recovering slowly but surely, but Mark has been a handful.
Okay. Well, I have an idea. Let's, these puppets right here, they are out because they all want to talk. Okay? So, let's all get a puppet, and I think what they want to talk about is they want to talk about the accident where your brother got hurt. Okay?
Okay.
Before y'all came, I heard them saying, we really want to talk about the accident. Okay? So, my little guy, he's going to kind of lead the way. Okay, so, Dinosaur, I heard you talking about the accident. What did you want to say about it?
I'm mad,
You're mad?
yeah.
What are you mad about? Tell me.
I'm mad that my brother got hurt.
Aw, yeah. How mad are you?
Really mad, like,
Really mad?
wanna hurt something,
You want to hurt something?
yeah.
Do you want to eat something? Or what do you mean when you say you want to hurt something? You want to gobble something up?
I just don't wanna feel mad, so when I punch something or punch a wall or throw something, it makes me feel better.
Oh, okay. That makes sense. Yeah, I can understand that. Sometimes when I'm sad, I feel mad too. Mad and sad feel very, very much alike sometimes, don't they?
Maybe, I just feel mad, but I guess I'm sad too.
Oh, yeah.
We don't get to play together.
So, Dinosaur, if you are mad, but you're at school, is there any way you can be mad but not bite or gobble up somebody else?
I don't know, maybe,
What do you think you might be able to do?
maybe. I just want to be able to play with people and talk to people.
Oh, okay.
Okay, so I'm going to be talking about the rationale as to why someone might choose to use puppet play therapy with either an adolescent or an adult client, but any time in which it might be effective to use this intervention. So, in the case study that we chose, you'll see that Mark, who is the identified patient, is coming in and kind of having a hard time articulating what's going on in his life. It seems he has an understanding of maybe what's been going on around him, but in terms of discussing it with the therapist or being able to effectively communicate with his mother before acting out behaviorally, it seems he gets a little clouded. So one of the reasons that we might use this intervention would be because of that he's feeling a little bit stuck, that he's not able to kind of move out of that side of his brain, which would be he is stuck in the left side of the brain, and doing something like this pushes him into the right side of the brain, so where he has to use creativity and kind of be active in coming up with a story and really pulling him out of maybe even how the two connect at all, without consciously really knowing that. Another reason that you might see a therapist use this type of intervention would be with clients who are really struggling with anxiety. So being able to put on a show and almost externalize the anxiety and not make it something that is about them, but something that happens to them. Being able to say like, oh, well, the puppet experiences the things that I also experience, and it might lead to lifting a little bit of a burden off of them. Another reason why you might see a therapist use this intervention would be with children who are afraid of medical procedures. So this one I think is really cool and super effective because it really shows and like kind of just gives them a better understanding of what like words mean. I think about my time whenever I was in nursing school and like trying to explain a procedure to a child is really difficult. Sometimes they just don't understand what you mean. I don't know if it's just they're not developed enough or what, but it's difficult. So showing them something is a little more effective in the sense of kind of not making it so big and scary. So if you are working with an adolescent who maybe has just gotten a serious diagnosis and maybe they need surgery and they're just terrified. You could then show them with puppets what that might look like. So you would show like a nurse caring for a little boy. Maybe she brings him ice cream, or they show him like, so what would happen is you go to sleep and then you, like the doctor does this and he uses his special tools to make, like to fix this and that. And it kind of just normalizes and takes a little bit of that fear out of the children to be able to see it in the way in which it would happen to them. Another reason that we wanted to highlight was kind of to show that a different way for children to express feelings. Mark kind of does a little bit of this in his in the example that we use in the video. It's a way for him to express a time that like he also felt fear.
So in our little video, client case, Mark's brother was in a car accident. He's okay, but they've come in because he's acting out in school, having some behavior problems, and Maury is having to use a lot of her attention to nurse back to help the brother. The end.